Today, in this video, we'll discuss about E. coli O121 H19 outbreak in US in November 2024, and then we'll discuss about the Shiga toxin producing E. coli. We'll briefly cover about these subheadings. Recently, there was a multi-state outbreak of E. coli 121 infection in the United States. This illness started on September 6, 2024, and then it has been linked to the multiple brands of recalled organic whole bagged carrots and baby carrots sold by the Grimmway Farms. And as of November 17, there has been 39 cases of the E. coli infection from the 18 states, and there has been one death as well. FDA and CDC, in collaboration with the state and the local partners, are investigating about this illness, about this outbreak of Shiga toxin producing E. coli O121 H19 infection, which has been linked to the carrots. This is the case count map provided by the CDC as of 15th November. Here you can see that there has been cases from multiple states. Total 39 cases has been reported with 15 hospitalizations, one death, and the illness onset is thought to be October 20th, 2024. Other than this outbreak related to the carrots, there has been few other outbreaks related to the E. coli, although with some different subtypes. Like there has been outbreak from the McDonald's onion. It was related to the E. coli O157H7 strain, and similarly, recently, in the end of this November, there has been few cases reported to be because of the E. coli 157H7 associated with the ground beef from the Wolverine packaging company. So from this, what we can understand is this Shiga toxin producing E. coli is capable of causing multiple outbreaks, and we need to understand what is this Shiga toxin producing E. coli, how to diagnose this condition, how to treat this condition, and how to prevent this condition. So before going into the Shiga toxin producing E. coli, we'll briefly discuss about E. coli, and then we'll discuss in a little bit more detail about the Shiga toxin producing E. coli, because this E. coli O57H7 as well as this E. coli O121H19 both are Shiga toxin producing E. coli. E. coli is a gram-negative bacteria of a Enterobacteriaceae family. They usually live in the gastrointestinal tract, and most of the strains, they do not cause the illness. They are divided into the various serotypes based on the surface antigen, like flagellar H antigen and the O antigen. Similarly, they are divided into the various pathotypes based on the virulence genes. E. coli can cause infection anywhere in the body. Like it can cause meningitis, it can cause bloodstream infection, it can cause urinary infection, and the gastrointestinal infection. Those E. coli that can cause this diarrhea are classified into 6 pathotypes, which include enteropathogenic, enterotoxigenic, enteroinvasive, Shiga toxin producing, enteroaggregative, and diffusely adherent E. coli. So we'll focus on this E. coli, Shiga toxin producing E. coli, which is capable of causing multiple outbreaks and hemolytic uremic syndrome as well. The Shiga toxin producing E. coli is also known as barotoxigenic E. coli. It is a major foodborne pathogen capable of causing diarrhea, hemorrhagic colitis, and hemolytic uremic syndrome. This picture shows the hemorrhagic necrosis of the colon following the E. coli infection. Basically, there are few serogroups of the Shiga toxin producing E. coli that are capable of causing the foodborne outbreaks in the world. They include O26, O45, O103, O111, O121, O15, and O157. While discussing about Shiga toxin producing E. coli, we need to be familiar with one term, enterohemorrhagic E. coli. These are the subgroup of Shiga toxin producing E. coli that are capable of causing bloody diarrhea and HUS. So the main source for the foodborne human Shiga toxin producing E. coli infection is raw meat, basically the beef. The reservoirs are usually ruminants like cattle, goats. This Shiga toxin producing E. coli is capable of causing multiple outbreaks because of one reason, that the number of the bacteria required to cause the human infection is low, and the presence of fewer than 1,000 bacteria can cause the human infection. So now let's talk about the Shiga toxin. Shiga toxin is an exotoxin. It has AB5 toxin structure. Like we can see, there are 5 pentamers of the B subunit, which are covalently associated with the A subunit. This A subunit is a cytotoxic protein that leads to the inhibition of the protein synthesis and leads to the apoptosis of the cell. And this B subunit is a pentamer that directs the binding form of the holotoxin on the eukaryotic cell structure. This picture shows the mechanism of action of the Shiga toxin. So when the bacteria produces Shiga toxin, it undergoes endocytosis via this clathrin-mediated mechanism, and it is transported to the Golgi complex and then to the endoplasmic reticulum, and it ultimately inhibits the protein synthesis, leading to the cell death. Transmission usually occurs through the fecal-oral route, primarily via the contaminated food or water. It can also transmit from person to person contact, and it can also transmit through the contact with the animal and their environment. As we have discussed, the reservoir is the intestinal tract of the animals, usually the cattle and other ruminants. So there has been various food sources and the animal sources which has been associated with recent outbreaks. So some of the source that has been associated with outbreak include the contaminated food, especially leafy greens and the ground beef, unsafe water, animal, their fishes and their environment, and fishes of the infected person are also the source of infection. Similarly, recently in 2024, organic carrots has been associated with the outbreak. Similarly, there has been outbreak related to the onions in the McDonald's and the ground beef in the Wolverine packaging company. Incubation period ranges from 24 hours to 10 days, but most of the patients, they develop symptom at around 3 to 4 days after the exposure to the bacteria. Symptoms include severe stomach cramps, diarrhea, which can be bloody. Patient can present with fever, nausea, vomiting. Sometimes they can present with the features of hemolytic uremic syndrome, which include renal failure, thrombocytopenia, and in some cases, patient can develop high blood pressure and can progress into the chronic kidney disease and can develop neurological problems as well. And if diarrhea is severe, patient can present with the features of severe dehydration. For the diagnosis, history and physical examination is very important. We need to ask about the exposure to the contaminated food, water, and the recent exposure to the cattle, basically to the ruminants. And we have to ask about the travel history as well. Diagnosis is usually made through the various lab testings, like stool culture can be performed. Similarly, serotyping can be done to identify O and H antigens. And one of the reliable mode of diagnosing is the RT-PCR. It can detect it can identify the bacteria as well as it can identify the genes that encode the Shiga toxins. Similarly, Shiga toxin can be detected. All the cases of this Shiga toxin producing E. coli should be reported to the public health laboratory for the further characterization. Like in the public health labs, they can do DNA fingerprinting using the whole genome sequencing. Treatment is usually supportive. Most of the patients, they recover without treatment after 5 to 7 days. But some patients who develop severe infection might require hospitalization, like patients developing hemolytic uremic syndrome or severe dehydration or hemorrhagic colitis might require admission. IV fluids and the oral fluid are the important modality of the treatment, and most patients, they recover with this only. Antidiarrheal medications like loperamide should be avoided because it increases the chance of hemolytic uremic syndrome, toxic megacolon, and the neurologic complications. Antibiotics should be avoided in the Shiga toxin producing E. coli because it increases the chance of HUS. However, in some severe cases, we might need to use the antibiotics like fluoroquinolones, macrolides, and rifaximin, but it should be avoided as much as possible in Shiga toxin producing E. coli infection. The infection can get complicated and patient can develop severe dehydration, hemolytic uremic syndrome, and patient can also develop hemorrhagic colitis, and in severe cases there can be death as well. So how can we prevent E. coli infection? So we can do that by keeping our hands clean, by preparing food safely, by drinking safe water, and by drinking pasteurized milk and juices. So during outbreaks, we need to be a little bit extra careful about our eating habits, and we need to avoid eating all the recalled products, and we should check your refrigerator and freezer for the recalled product and throw them away if there's any left in the fridge. Any items or the surfaces that has been in contact with the recalled products should be cleaned properly with the hot soapy water or dishwasher, and you should come in contact with the healthcare provider as soon as you suspect that you have E. coli symptoms. These are the references which we used while creating our video. If you want to know in more detail, you can go through these articles. Thank you so much for watching. Please subscribe to our channel for more videos.